evidence. So although I agree with the effort to not provide false hope, I think doctors need to also understand we need to also be providing the right kind of grounded hope, because that's critical as well.
And imagine how different this whole oncology system would be if they studied this, you know, and they saw the evidence, and then it opened up their eyes and they could give this to their patients, and it would give their patients grounded hope.
That's right. Yeah. You don't want to impose a pathway that isn't right for a person. Every person needs to choose a pathway for themselves that feels liberating. It's the judgments that we impose on ourselves, the psychology that we apply, that creates so many of the burdens that people carry every day. And so whatever path a person chooses, it needs to feel liberating for them. And that's a critical piece of this. But back to your question about what cultivates the soil for the possibility of recovery. The reason why I think it's important to word that way, and I know you will understand this with the kind of work you do, is that I don't think we can heal ourselves. I don't think a healer can heal a person. I don't think a doctor can heal somebody. But what I think we can do is we can cultivate the conditions that make healing more possible. And I think what that has to do with is cleaning up the toxic foods or the chemicals that we allow into our lives. It means cleaning up the toxic thoughts maybe that we allow into our minds, to heal the traumas in our lives, to heal our immune systems, as that's one of the pillars, as you know, of healing and well-being, to heal our stress response so that we're not bathing our beautiful immune cells, our beautiful bodies, in the toxic chemicals of stress hormones over and over every day. The drip of the cortisol or the norepinephrine or the adrenaline. Our bodies and our immune systems just respond so differently when they are bathed in dopamine, which is the pleasure molecule, or oxytocin, the love molecule, serotonin, the antidepressant molecule. Our bodies just wake up and our cells respond correctly, and they identify the pathogen correctly when they're getting bathed in that kind of chemical environment, as opposed to the drip, drip, drip of the stress hormones day in and day out, which we know on the basis of clinical experience and laboratory data causes the cells to misfire, causes the immune system to begin attacking the body instead of the pathogen, or to begin attacking the body instead of the cancer. So these are all really important issues for healing.
Absolutely, absolutely. So let's talk about activating the healing mode and the relaxation response. So this is something I drill in our community, is get into that relaxation response every single day. So explain to our listeners why that relaxation response is so important, and how do we get into that relaxation response?
Yeah, I mean, that is really critical. I think life is tough, right? I mean, we all grow up with a lot of different kinds of experiences. We take in the beliefs of our parents. We take in the beliefs of kids in the playground. We inherit the true and false beliefs of other people in our lives, whether it's friends or partners or bosses or teachers. And some of these beliefs are true, some of them are false, some of them help us experience our value as human beings, some of them teach us that maybe we're not good enough, or there's something wrong or defective with who we are. Sometimes trauma occurs, whether it's something like physical, emotional, or sexual abuse, or developmental trauma, the drip of false beliefs that cause us to question our value or not experience that. And so at the end of the day, a person, because of these false beliefs, ends up in chronic fight, flight, or freeze. And that results in a neurochemistry that's very harmful for the body when it's a day in, day out sort of thing. So how to get out of that into a parasympathetic state, which is about activating the vagus nerve, the superhighway of the parasympathetic healing response in our body, so that our bodies can heal. That is a really important question. And there's two main ways to do that. One is the relaxation response, which you mentioned, and how to relax our body so that we can get into that more relaxed state. The other one is to make authentic, loving contact with ourselves and others in a way that we can activate that healing neurochemistry. So whether it's 30 seconds of contact with a person at the checkout counter, or with the mail carrier, or with a loved one, when we make authentic eye contact with somebody and we're able to authentically smile and connect, that activates a neurochemistry that our body loves. And that is what activates the vagus nerve. The vagus nerve, for example, are the nerves connected with what curves the lips up into a smile, that allows you and I to make eye contact in a way that our eyes are bright and it's genuine. That's the vagus nerve. And those kinds of activations are what the body loves. And that's what allows the body to do its healing work with the kind of neurochemistry that allows all this to occur efficiently.
Okay, so that brings us to, if we're talking about the nerve system, that brings us to the miraculous mind, right? I mean, Joe Dispenza, you know, he's a fellow colleague and friend, and I love the work that he's done, and he's obviously backed up everything with so much wonderful research. So explain how the placebo effect actually works. I mean, we know if we believe something, then our body, you know, the chemistry is there so that, you know, it allows the body to function better. But in a situation like, you know, somebody was diagnosed with cancer, and, you know, they want to facilitate the healing. What sort of things would, how could they use the power of the placebo, I guess is what I'm asking.
Yeah, that's a good question. There's a variety of ways to do that. And we need to be doing a lot more research with the placebo effect. It's something that is universally understood in medicine, but we don't pay a lot of attention to it. It's something that we account for in our studies, but we don't examine it usually in what it is for itself. So the placebo effect is effective between 10 and 90% of the time. It's very powerful with psychiatric medications, for example. I think the placebo itself, the placebo effect, is a umbrella term for a lot of different capacities of the mind that get activated in different ways, whether it's the beliefs of the person or the experience a person has with a physician or healthcare provider who is very compassionate and treats the patient as a human being, for example. That can activate certain placebo responses. The white coat of the healthcare provider has been known to activate the placebo response. So it's an umbrella term for a lot of different factors that are related to the capacity of the mind to heal itself. We know that large pills activate a more powerful placebo response than small pills. We know that red pills are more active than blue pills in some situations. We know that surgery activates a more powerful placebo response in general than pills do. So there's all these different kinds of issues connected with that. I report on the Research in Cured about the very common knee arthroscopy surgery, for example. And so one of the most prestigious medical journals reported a meta-analysis of all of the studies that have been done on knee arthroscopy a number of years ago. And it's one of the most common surgeries. People who have knee pain, and they often will get knee arthroscopy. Well, the meta-analysis of all these studies found that, and after the result of some studies that they completed themselves, they found that the people who actually received arthroscopy had exactly the same level of benefit as those who had been put to sleep under anesthesia, had a little cut provided over the knee and then stitched up, but no actual surgery. the results were exactly the same. And so had a very powerful placebo response. In spite of that, it continues to be billions of dollars of that surgery are done every year in the United States. And it's a very common surgery. It did not change the trajectory of practice or the trajectory of how often that's done at all. But it's
interesting. I know I've used that study in some of our retreats, and it's fascinating. There was another one where they did in the 80s that had to do with angina and heart surgery.
Oh,
Same
right.
thing.
Yes. Right.
Open them up, close them back up, and they had better results than those actual surgery.
I know. Yep. Yep. It's very difficult to change how we practice in medicine. It's not just rooted in evidence, for sure.
All right. You are not your illness. Now, this is something, especially with breast cancer, I find that, so many women, because, breasts are related to so many emotions of nurturing and mothering or not being nurtured and guilt and all that. And sometimes women can get stuck with that, I am the breast cancer. And
right.
So how do you work with that with your patients or in your research? How do you see that?
Yeah, I mean, that raises a lot of questions, and it's a big topic we could walk around all afternoon probably. And you're right, the breast is symbolic of so many things around nurturing and care and love and what it means to be a woman in many ways. And we're not our illnesses. We're not our bodies in that way. I've come to believe as a result of this 19 years of listening to these stories, I've come to believe that at some level, we're not our bodies at all. We're these invisible souls walking around, and the bodies, I think, are a metaphor for something the deeper self or soul is trying to learn. And there's a lot of implications from seeing it that way. It caused a dramatic turning upside down of what I learned in seminary, even what I learned in medical school, what I learned in residency to become a psychiatrist. And so it's a very different way of thinking than we're usually taught to think in the West. One way to walk around this big topic, there's a story that comes to mind with a woman who had breast cancer. And I was really affected by her story because it resonated with so many of the stories I've heard over the years. She was married to a man who loved her, but he was verbally pretty rough on her and verbally abusive in some ways. She is somebody who had always been a very demure, loving, kind woman. I think in retrospect, the way she understands this is that she was hesitant to take up space in the world. She felt like she spent much of her life taking care of the needs of others, responding to the perceived expectations of others. In the context of her healing, she became more willing to take up space in the world. She became more racy. She became more, I'm going to tell you what I really think. And became in some ways a less compliant patient because she began to push back and do what she felt was best for her rather than just what was being recommended to her. All of that is a really good example of somebody who began to wake up. She began to wake up to her value, I believe, as a person, as a woman, to feel comfortable with who she was, to not apologize for who she was. She began to stand up to her husband. She began to ask for different things from her friends. And I think that's such a beautiful example of the kinds of shifts in identity, the kinds of healing that occurs in breast cancer and in other kinds of cancer. There's something about her story that is so important around these issues. So I don't know if that addresses your question.
No, that's a great story because people who have cancer have that cancer personality, right? And so many of them are always doing more for others than themselves, and they're not managing their stress properly. And for true healing to occur, they really need to, like you mentioned, appreciate her value, set boundaries, learn to say no, all those things that are so important to validate, who you are as a person.
Yeah, that's right. It was a huge lesson for her. And these stories are messy, right? And not only for her, but for other people, because once you begin to ask for different things in your relationships, that's messy. The person has to the loved ones need to either change to keep up with who you are now, and at some level renegotiate the patterns of the relationship, or these relationships end. So for her to begin stepping into a strong experience of her value as a woman and as a person, that required some deep changes in her relationships. And sometimes these relationships don't make it through that. And so those are messy things, and people will question themselves. And you have to really become clear that you don't need to apologize for who you are. And it's okay to take up space in the world. And it's really important that you value who you are and know how to say no, know what you're saying yes to. These are big things. And
Yeah, very important part of healing.
it really is.
So last question. What do you think about generational healing?
I think it's massive.
Yeah. Okay.
Yeah, as a result of all of this research I've been doing for many years, I've begun paying more attention to what's called internal family systems work by Richard Schwartz. And he talks a lot about this kind of thing, about legacy trauma, about the ways in which trauma can be visited upon the generations and how it even changes our DNA, whether it's racial trauma. I can tell you stories of that, or Holocaust survival trauma, or sexual assault that occurred in a great-grandmother, and it's a story that got lost consciously, but then is experienced at a really deep level with it's just uncanny how brilliant the subconscious is, but also how it works itself out into the physiology of an individual body. Mm-hmm. And it's so critical to go back and address these things. Sometimes these stories begin appearing in dreams. And a person just told me the other day, actually, about how she began having these dreams of abortion gone wrong and something really, this nightmare. And then she finds out that she had a great grandmother who was African American, who had an abortion that went bad. And because she couldn't be admitted to a medical hospital because of her race, she died slowly by bleeding out over a period of days. And it's just a devastating story, and how helpless and hopeless it must have been to be in her shoes. But this person didn't know that story consciously, but she began having these dreams, and they felt so vivid to her that she began investigating where would this be coming from. And as she began to ask questions about her family history, this is the story that came out that had been buried in the generations. But
wow.
I mean, and so she did a lot of healing work around that, so that she could heal her own deeper mind and unconscious and her body around the story that she'd been carrying about this. So these are astonishing stories. Legacy trauma is real.
It is. And I know the